how patients really do want to engage with their clinicians and their healthcare system. Let's find out. Hi, I'm Janae, neurocritical care stroke and epilepsy specialist, and today we're going to talk about a very important topic. The most important topic, in my opinion, for your future as a clinician, as a healthcare system, as a healthcare administrator, as a healthcare executive, no matter which portion of your healthcare you are currently involved in. You need to know this, because what patients really need is engagement, period. That's the goal of any particular business per se or service provider per se. It doesn't matter if you're a barber, a restaurant, or anything. What you want is basically engagement. As far as engagement is concerned, in terms of patient engagement, in terms of physician and patient interaction is concerned, we are looking at a significant trend towards digitally enabled communication, towards digitally enabled engagement. We are seeing that there's a massive shift in patients' attitudes towards digitalization of healthcare itself, especially the engagement portion of things. Why is that? Look, it's very simple. No matter how we shop nowadays, how we actually consume entertainment, how we book our hotels, how we get even our food now is all digital. And therefore, since everything around us has gone digital, why not healthcare? The consumer expectation in general around the world is basically digitally enabled interaction, digitally enabled engagement. And if I can do everything on this, why the hell am I not able to at least have some level of engagement with my clinical team, some level of engagement with my overall healthcare system that is digital? In the current progressive digital world, consumers use technology in almost everything. Everything is digital and just one click tap away. You can get access to whichever industry you want, right? Maybe it could be healthcare, it could be airline, it could be restaurant, anything. This is going to become the most important factor in distinguishing yourself from the herd if you are digitally enabled. Now let's look at the evidence, right? I mean, that's great. Everyone talks about this, but really, where is the evidence for it? So let's talk about that. One of the key things that are important to understand is that what is going on. If you look at patients who are checking in, just literally checking in for their healthcare appointment, for their outpatient surgeries, how are they doing it? Even urgent care clinics, even urgent centers, people are going online on their website, looking at the time, the wait time, and checking in over there and leaving according to that time right now as we speak. So 64% of patients are now doing online checking before they even leave the house to interact with a healthcare system. It could be a provider, it could be a clinician, it could be a hospital system, anybody. The complete interaction right now, more than 50%, at least the checking in portion, the minute that I decide that I'm gonna get care is now digital. They're doing it online. Another thing, for regular appointments even, right? For example, if there's a constant appointment that you're seeing your primary care physician, your oncologist, your neurologist, your psychiatrist, anyone, you're basically nowadays checking in through your text message. You get a text message that, hey, is that for you have an appointment, blah, 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 on this time and date. Are you sure you're going to attend it? You click yes, or you send yes, whatever, and then you are able to get that appointment. That check-in is now via text message. No more calls. More importantly, even more than phone calls, they're using emails as compared to doing phone calls. So it's a significant shift in terms of patients using them. And by the way, this is looking at right now who is getting healthcare the most. It is not the millennials, it's not the Gen Z, it is not the person like me and you who's constantly on their phone. At the end of the day, these are people who have been above the age of 60. And believe it or not, those people who are above the age of 60 are doing this. So what do you think is going to happen in the next 10 years? Do you think I'm going to go back and say, oh, you know what, this is really inconvenient, I'm going to start calling? Of course not. So this is already what's going on, and look at what is going to happen next. The digital shift is going to get deeper. The digital shift is going to become the norm. As a matter of fact, if somebody's going to pick up the phone at some point in time, you're going to say, what the hell happened? Is somebody having a huge emergency? And that's literally what happens. Interestingly, if my mom calls, I feel like, what happened? I need to call her back right now, because she texts me. And then if she texts me, I said, okay, I'll answer it because it's something that she wants information or whatever. But if she calls me, my heart races, because that's the level of communication that we do. And she is 70 years old. So therefore, there's a significant shift, not in generation like millennials and younger generations. We are looking at that shift at an older level, people above the age of 60, 65 that are doing this. So what do you think in the next 10 years is going to be like? That was very interesting. And I keep talking about it that pandemic, the only silver lining was the digital shift. But this is extremely important fact that you need to know. And this was based on a 2020 Accenture survey in which 9 among 10 patients, over 90%, basically said that they received equal or better quality care during COVID using digital technologies as compared to before. And about 40% of them cited this was more convenient, this was more accessible, and given that there was new communication tools, especially like chat services, online platforms, they actually felt that this was a process that was more streamlined because there was less confusion. Even providers were happier because they knew that somebody's canceling at an opportune time and they can fill in their particular block to see another patient. So therefore they were also happy in terms that they were not wasting precious resource, which is at the end of the day the most important precious resource is what? Time. So they were not wasting time waiting for a patient. They were not wasting time because of a canceled appointment. So there was basically convenience at both sides of the coin, and they were both happy in terms of digitally enabled care. One of the ways that we're going to move forward in healthcare is making healthcare more patient-centric, period. Patients are what? I hate the word consumer to be equated to patients, and I just truly hate it because they're not consumers. Nobody consumes healthcare, which is really odd because technically we are a sick care, we're not really healthcare, right? So yes, if we were healthcare, yes, there should be consumers and there should be lots of consumers. People should be consuming healthcare products to make themselves healthy. But let's face it, we are a sick care, and people who are actually consuming sick care are unfortunately patients. So patients, sick care, consumers, healthcare. Those are two different things. We are going to see a significant shift towards sick care to healthcare. People are going to spend more on their healthcare as compared to just sick care. You're going to see a strategy that is consumer-centric, like in any other industry. We're going to see that digital shift will embrace consumer-centric digital tools and sustainable models that will engage them in their care. They're not just sick care, they're health care, and they're going to be able to deliver flexible, convenient experiences that truly what people want. One of the products we are building, NeuroCare AI, and the core product is care management that brings in a completely digital experience for patient to clinician engagement. So both of them are true parties in improving healthcare outcomes. Stay tuned, it's going to be available early next year.